Hi everyone, Monica Moore here, nurse practitioner, and on this edition of Ask Monica, we're going to be talking about IUI cycles, intrauterine insemination, or basically like a low-tech non-IVF cycle. And we often get asked the question of how many cycles of this we should do before we move on to IVF. And so the question really we have to put into context that when anyone is trying to conceive using a certain medication or therapeutic protocol, we usually like to give you 3 to 6 months to conceive within that protocol. If you are somebody that doesn't ovulate regularly and you really aren't getting a chance of getting pregnant that month because of not ovulating regularly, we would be more inclined to have you try for 6 months. If you're somebody though that regularly ovulates and you're not getting pregnant within the 3 to 6 months, we might talk to you about, let's try this certain protocol for 3 months and then give you options for future protocols. Depending on how well you do with the medications during the IUI cycle, that's another component. So if you are somebody that regularly ovulates, and when we give you medications, you're only making 1 or 2 follicles or eggs, that's not really giving you much of a better chance than if you're trying on your own. So we would want to hopefully give you a better chance by maybe making 2 to 4 follicles. If you're somebody who does not regularly ovulate, then 1 or 2 follicles each time would be okay. The other limitation is insurance or insurance coverage. Some people's insurance has a lifetime max. So if you have a lifetime max, you may want to consider how much does each IUI cycle cost and how much does an IVF cycle cost. An IVF cycle for most people, and it really depends on your age and why you, or what the reason for your infertility is, if we know it, is obviously going to be more expensive, but it also gives you sometimes 3 times the chance of getting pregnant that month. You can get a chance of getting pregnant up to 70% a try for IVF, whereas for IUI cycles, it can be anywhere from 5 to 15%, again, depending on your age, your reason for fertility. The other thing I would like to mention is if you're doing insemination cycles and it looks like the sperm sample is low, if there's any kind of mild to moderate male factor, we may talk to you about doing IVF as well, so that we can potentially do ICSI, where we inject each egg with a sperm to give you a better chance. Finally, if you actually are a very robust responder and we're doing medicated IUI cycles and we're finding that you have a hyper response, you're making so many follicles each month that we have to cancel your cycle, or we're putting you at risk for something called Ovarian Hyperstimulation syndrome, we may suggest that you go to an IVF cycle sooner. That way, no matter how many eggs or follicles you make, we will retrieve them, and we only will replace 1, hopefully 1, sometimes 2 blastocysts. That puts you at much less risk of hyperstim, much lower risk of high order multiples. So hope that's helpful. Usually whether you and when you move on is an individual decision that you make, or a personal decision, I guess I should say, that you make as a couple, if you are a couple, and with your physician. We're trying to give you every option. And so we will talk to you when we see you about, here's what our recommendation is, here are all of your options, and then you take all those variables into account when you make that decision. So hope this helps. As always, please continue to send us questions or any requests of what you would like to hear about, and good luck with your fertility journey. Thanks so much.